one of the things that we haven't touched on, which latches onto what you just said, is that as you do research in a university lab, all the research is published. And so I'm assuming that any breakthrough technology or innovation that comes out of the lab will be made accessible to most institutions and hospitals, whether they're private or public. But when we actually look at the who owns the technology and who can make the operations, where do we stand worldwide? Is it mostly Western countries that have these technologies provided from public hospitals? Or is the technology broadly available to any private hospital? I'm not sure.
Yeah, the equipment that you need to make this probably costs £500,000 to £1,000,000 for a basic lab. And if you want to make this GMP, which is, sorry, that's a technical term to say good manufacturing practice quality, which is what you need for a medicine, at least in the UK for sure. It's extremely expensive to make things to that quality, especially things that you need for genetic engineering, like viruses and cells grown for many weeks in this kind of quality lab is just absurdly expensive. This is where all that cost comes from. And this is why it costs £500,000 per treatment, right? That's where that comes from. It's the cost of the reagents and the process for manufacturing these therapies in a system which is medical grade. Because what you really don't want to do is to make it in a sort of a shoddy lab, inject it into somebody, and then they die of sepsis because they've been infected with a bacteria during the manufacturing process because you haven't done it cleanly enough, right?
Mm-hmm.
Or you've caused some other issues for the same thing. So they have to be made really, really, really high quality. So to set up one of these labs is very expensive. Although that's not to say that it's impossible. And I saw a really cool article a couple of years ago now, I think, where some lab in India had managed to manufacture medical grade CAR T cells for 1/10 of the price of the West. So it's definitely possible to bring those costs down. And in fact, some of the other things that I talked about, like the in vivo generation, which is to say making it in your blood instead of outside in the lab through various techniques, that's, I don't know, 1/10, 100th of the cost. So much, maybe not 100th, but yeah, much cheaper.
Mm-hmm.
So these various different innovations, it's driven by demand and market forces in a way, isn't it? As many things are, if it's something that can be sold around the world, there is a drive to make this as cheap as possible and as accessible as possible, right? Also, you talk about these pharmaceutical companies sometimes, not you personally, but people talk about these pharma companies as if they're these money-hungry, demonic people. But actually, most people in these companies just want to make treatments and help people. They're same as any other researcher, right? So there is a drive to make this stuff as accessible as possible from a non-profit based incentive, is what I'm trying to say. People just want to help and cure people, no matter where you work. So
yeah, I'm just playing devil's advocate here. I don't think that people are directly accusing the researchers within the labs. I'm sure that they have really good motivations and they're driven by the interest to change the world for the better. I think the accuses are mostly pointed at the business models that price some of the medicines with massive margins compared to the production costs. So I don't think that we're necessarily referring to the researchers, perhaps more to the executives or business model of some of these companies. But I could be wrong.
Some of these stories, yeah. I mean, especially in the States where they make these medicines vastly more than the cost, as you say. But in the CAR T-cell world, there genuinely is a huge production cost with this stuff.
Yeah.
And from my limited experience in pharma, I saw these executives, they just wanted to help people also, for the most, their main driving force. I mean, of course, they were trying to help the business, but they also wanted to help people. So there is that incentive in these people also, I think. And I also think that, the cost of a CAR T-cell is, I don't know if it's exactly at cost that they make this, but there's not a huge amount of profit injected into that hundreds of thousands of pounds manufacturing cost that I mentioned. That's just what it costs to make them.